I don't know if you've seen it. I have over the last several days. There's been a lot of press about some new studies that are coming out that are talking about a discovered relationship, particularly in maternal obesity, but also in paternal obesity, and an increased risk of ASD or autism spectrum disorder in children. Studies suggest that children born to obese mothers, particularly those with diabetes, have a higher likelihood of being diagnosed with autism. And while paternal obesity also is associated with increased autism risk, the link is not as strong as with maternal obesity. So let's take a look. And so you guys know, you can basically, I think I pulled this up on Google and I typed in parental obesity and ASD. And this is just what pulled up. It's a screenshot. Maternal obesity, so obese mother, and autism. So some studies suggest that maternal obesity is associated with a 30 to 92% increased risk of autism in offspring. So in their children, a 30 to 90% increase is astronomical. And then it gets worse, unfortunately. So children born to obese mothers who also have diabetes have an even higher risk, potentially 4 times greater. So if the mother is obese, there's a 30 to 92% increased chance of that child being born with ASD. If the mother is obese and a diabetic, that risk can be up to 4 times higher, astronomical. And the risk increases with the degree or the severity of maternal obesity, right? So the more obese the mother is, the greater the risk. The more obese the mother is, the greater the risk. Throw diabetes on top of that, and the risk is astronomically higher. So paternal obesity and autism. Some studies actually indicate that paternal obesity may also be associated with an increased risk of autism. One study in particular found a 73% increased risk of autism in children of obese fathers. And the evidence supporting a strong link between paternal obesity and autism is actually less consistent compared to the link with maternal obesity. Now, here's the thing. Research suggests that maternal obesity may influence fetal development. Obviously, I think we all know that, right? But this new piece is the potential increased risk of a offspring or a child being diagnosed with ASD or being born with ASD. And the next point is, it makes perfect sense, right? It's because the changes, when a person is obese, they experience changes in hormone levels and in inflammation levels. And what they're postulating is that the changes in the hormone levels and inflammation during pregnancy as a result of the obesity may play a role. Personally, I think it definitely does. And then that some studies have also suggested that genetic factors may contribute to the link between maternal obesity and autism. So now, back to my obligation. Here's the thing. If you have patients that are considering getting pregnant and they are obese, now that you know this information, I personally feel that there's some obligation that you have to talk to them about this. Is something that I think we can all get behind. And my brain immediately goes to females with PCOS. I can't tell you how many times that we've heard that there's been a patient that had PCOS, hasn't been able to get pregnant, and then does ChiroThin, loses the weight, PCOS basically goes away and they're able to get pregnant. I think this information, I think we should almost be mandated to share this with every patient that we have, because even if you have somebody in your practice that is not trying to get pregnant, but they know somebody that is, and that person is obese, I think anything that we can do to reduce this risk, reduce this chance, I really feel that it's incumbent upon all of us to do that. So I don't mean to really get heavy, but so at any rate, let me get out of my heavy mode here. Great information. You guys definitely need to be sharing this with your patients.